the St. Gallen meeting, which for the first time is in Vienna, not in St. Gallen, is an important conference because the first days at the conference you hear all the news of the last 2 years that came up, all new results, findings. And then on Saturday you have an international big panel, and they go through their guidelines they have from the 2 years ago, and then they decide if they change something because of the news they heard during the last days, if they change their guidelines for all different parts of treatment, radiotherapy, everything. So it's important because you have an international panel, you have the differences in treatments and everything in different countries, and they all have to find a consent on how the guideline should be. For a very long time, all the patients got everything, all kind of treatments that there are. And by now, finding out more precisely the differences between the tumors, you can find out which drug might be the best for the individual patient or which combination of drugs. So that's a very important part, and I think everybody is looking for it, not only because it helps avoid side effects of treatments that don't work, but also, I mean, the new drugs are so expensive that no health system will be able to pay it to all the patients. So you have to find out the patients that really have an advantage, or might have an advantage of a drug, so that you can give them and afford to give it to those patients and avoid it for the other patients. And what is also important are the Oncotype, EndoPredict, and all the different ones where in advance of a chemotherapy, there's a certain number of patients that can be tested, and then you can find out if they really need a chemotherapy or not. So even though the tests cost something, you avoid side effects for the patients, you avoid the costs of the treatments, and so on the long run it's better for the patient, certainly, to avoid a chemotherapy, but also for every health system. Even with the triple negative, we learn a lot by the time. And for example, last San Antonio meeting, it showed that the triple negative that have a BRCA mutation, that you give them carboplatin to the chemotherapy, that it is a big advantage. So now the question is, do we need to test all triple negative patients? Because, for example, in Germany, usually you only test those patients that have a family history with breast cancer. But I think it's a big discussion here. It was in San Antonio, and I think it will go on, that probably all triple negative patients will need the test of a mutation, so that if they have it, then they get the right drug that helps them through their breast cancer story.